Hello, my name is Danielle, and today I'll be demonstrating how to complete a full head-to-toe assessment on my patient. First, I'll start with hand hygiene. Next, I'm going to enter my patient's room and provide us with some privacy. Hello, my name's Danielle. I'm going to be your nurse today. And what is your name and date of birth?
Ariana Kashkari, 1994.
Perfect. And do you know where you are and why?
For physical exam.
Great. My patient is alert and oriented times 4. So you're right. You're here today to complete a full head-to-toe assessment. So first I'm going to start by asking you, are you in any pain at all?
No.
On a 0 to 10 scale?
0.
Okay. And do you have any allergies to any food or medication?
No.
None at all? Perfect. Okay, so what I'm going to do is I'm going to start by getting your BMI, which is your height and weight. So you can come with me. Have you step right on the scale here. Okay, you can go ahead and step up and turn around. I'm just going to get your height and step back on. Okay, and go ahead and step on. Perfect. So my patient's height is 5'4", 134, and that makes her BMI 21, which is in normal limits. Now, I'm just going to check your mobility and gait. So if you could just first walk on your toes and your heels, heel to toe. Wonderful. Now I'm going to check your Romberg sign. So if you could just keep your eyes open for about 10 seconds and then close them. All right. And now we're going to do that again with our feet sort of intertwined. And open. And close. And one more time, just heel to toe. All right. And again, that was just checking my patient's Romberg sign. Now I'm just going to get her waist circumference. So I'm just going to keep 60 and check the circumference of her waist. Perfect. Okay. And before you sit, I'm just going to take a look at your spine. So if you can just bend over to your toes, and I'm just going to palpate her spine, looking for lordosis, kyphosis, or scoliosis, and my patient is negative of all 3. Now I'm just going to take a look at her pelvis, and it's perfectly symmetrical. So now you can have a seat on the edge of the bed. And we will begin our assessment with the cranial nerves. So can you smile, frown, wrinkle your forehead, puff out your cheeks, stick out your tongue left to right? Perfect. And shrug your shoulders for me? Awesome. Now I'm just going to don some gloves and take a look at my patient's scalp. This here I'm going to be looking for any bumps, any bruising, or any infestation. I'm just going to palpate your scalp. And I don't feel any sort of bumps. And I'm going to inspect the area, and it looks free of any infestation. Okay, next I'm going to take a look at my patient's ears. Inside. Looks free of any drainage bilaterally. I'm just going to palpate your pinna, looking for any bumps. Perfect. And it looks symmetrical on your face. Next, I'm going to take a look at your eyes. And if you can just look at me, this might be a little uncomfortable for a minute. Perfect. Perfect. My patient's sclera looks white and moist, and the conjunctiva looks pink. Okay. Now I'm going to have you follow the tip of my pen as I make an X. And a T. Perfect. My patient's eyes and pupils are round, equal, reactive to light, and accommodation. Also, at this point, if I had an otoscope, I would be looking for the tympanic membrane in my patient's ears, and the pinna would go up and back and up and back. Okay. Next, I'm going to take a look at your nose and your mouth. So my patient's nose looks proportioned on her face. And I'm just going to also check there for any drainage. My patient is negative of. And I'm just going to check your patency. So if you can just blow and blow. Perfect. Now I'm going to take a look inside your mouth. Do you wear dentures? No. Okay. So my patient's lips, tongue, and gums look moist and pink. I'm just going to have you stick out your tongue and say, ah. And my patient's uvula looks back and forth as it should. Next, I'm going to take a look at my patient's neck. And my patient's color is pink. Her temperature is warm. Her skin is dry. Skin turgor is within normal limits. And next, I'm going to move on to checking your anterior thorax, and your posterior thorax. So for your anterior thorax, I'm first going to start by just palpating the area. Any pain anywhere?
No.
Okay. Across the area. Okay. I'm just going to listen to the lung sounds. Just going to take some deep breaths for me, okay? Okay. My patient's breath sounds are normal and her respirations are easy at 14. Before I move to the posterior thorax, I'm just going to inspect your trachea, make sure that it is aligned right in the middle. And you can go ahead and swallow. All right, no inflammation of the thyroid. Perfect. Now I'm going to move to the posterior thorax. Okay, so back here, just going to do the same and just palpate as I did on the front. Okay, and then you're just going to feel that percuss again. Okay, now I'm going to take a listen. So if you could do the big deep breaths again for me. Perfect. So my patient's breath sounds are normal anteriorly and posteriorly. Now, every time you feel my hands on your back, you're just going to say the word 99, and this is just checking your tactical phlebitis.
99, 99, 99.
Perfect. And lastly, on the posterior thorax, I'm going to check your thoracic expansion. So if you could just take a big deep breath. Perfect. Okay. Now I'm going to put you at a 45-degree angle on the bed, but first I'm just going to go through your pre- and post-auricular lymph nodes, submaxillary, and your supraclavicular, all negative. So I'm just going to have you lay on the bed, and I'm going to put this up to a 45-degree angle. All right, and I'm just going to raise the bed a little bit. I'm just going to be listening to your heart sounds. And before I go ahead and do that, I'm just going to check for any jugular vein distension. So if you could just look that way and look this way. Perfect. And then I'm just going to take a listen for your carotid artery for any bruising. Okay, and my patient is negative. So now I'm just going to be listening to your 5 heart valves, okay? So I'm just going to have you breathe normal for me. Okay, first I'm going to listen with my diaphragm and then with my bell. Okay, and lastly, I'm just going to take a listen to your apical pulse, which is at the midclavicular line in the 5th intercostal space. Okay, and my patient's apical pulse is regular. Okay, now I'm going to go ahead and check your pulses. I'm first going to start with the temporal. Okay, and the carotid, one at a time. Okay, and the brachial bilaterally. Okay, and the radial bilaterally. Okay, and now I'm just going to assess my patient's fingers. Here I'm just checking for capillary refill, and it looks normal, less than 3 seconds. And normal on that side as well. And here I would just be looking at the patient's fingers, and I see no sign of clubbing. Now I'm going to check my patient's bilateral pedal pulses. Okay, and both are strong. Then I would be checking my patient for the capillary refill of the toes. So it's the same as the fingers, less than 3 seconds. And my patient is less than 3 seconds for that capillary refill. Lastly, over here, I'm just going to check my patient's plantar reflex. Okay, and my patient has a normal reaction. Okay, are you feeling nauseous? Feel like you're going to vomit at all?
No.
No, so you're okay if I lay the bed down flat?
Yes.
Okay, so I'm going to go ahead and lay you down flat. And here I'm going to be assessing your abdomen. Okay, so you can just put your hands by your side, and I'm just going to take a look at your abdomen. My patient's abdomen is flat. I'm going to listen to the 4 quadrants for your bowel sounds. Okay, and my patient's bowel sounds are active. Next, I'm just going to percuss those same 4 quadrants. Just let me know if you have any pain. Any pain or discomfort?
No.
Okay, now I'm just going to palpate lightly. And here I'm looking for any masses or distension. And still no pain.
No.
Okay, I'm just going to go around one more time, a little harder, a little deeper. And still no sign of masses or distension. And you're still okay there? Okay, so now I'm just going to have you sit up, swing over to the side of the bed. Fix yourself. Non-slip socks, which is perfect. So I'm just going to lower this bed. And lastly, I'm going to be checking your musculoskeletal system. Okay? So can you extend your arms? Perfect. And rotate your wrists. And rotate your arms. Okay. And can you squeeze my fingers? Awesome. My patient's strength is great. Can you push up on my hands and down on my hands? Perfect. And down and up. Okay. And And that is the completion of the physical assessment.